maybe I shouldn't tell that story.
I would have probably reserved that one and not tell.
Yes.
But now that you've said it, it's gonna.
Well, people
we're gonna
say,
have to get that out there.
Worse.
What's up, guys? It's Dr. O, and I'm here with Dr. Megan. Well, I think last summer we introduced Dr. Jordan, and we kind of had you on a video, but it's time to make it official. Do something where you can share a little bit about yourself, so the channel gets to meet you and know what you're about. And
can't hide anymore.
That's right. And how you came here. So yeah, I have a whole list of questions that I'm going to try to pretend like I'm a real interviewer here, which I'm not. So, so just introduce yourself, kind of, tell us a little bit about your family, how you got into dentistry, and just kind of ad lib about your story about getting into dentistry.
Yeah. First of all, I, started liking dentistry from probably high school. I knew I wanted to help people. That was my primary thing I wanted to do, and I knew I wanted to be in the medical field. I was very artistic, and I thought, how can I combine all of this together? And my parents have a family friend that is a dentist, and he started talking to me about it one day and fascinated me. So I started watching him do some dentistry and just kind of connected all the dots and fell in love with it. Hey, bud.
All right.
Hey.
He's like, guys, I haven't been seen in a while.
Yeah, he has to be on camera too.
Yeah. All right, buddy. Do you want to come over here? Sit down.
It just all connected. I think it's one field in the medical field that you get to use your art skills, your people skills.
There's a little secret that I don't know if I really shared in the channel. Is there anything kind of cool about you and I getting to work together?
Yes, actually. It's one of my favorite stories because we went to high school together at Kickapoo. We knew each other. We both played basketball, so I knew he was kind of a rock star.
By the way, a lot of people think we're married. We're not.
Yes.
We do love each other like family.
But get it all the time.
Yeah, she has an awesome husband who's like my best friend.
Yeah.
So there you go.
He is my work husband technically, but yes, him and my husband are best friends. So it is nice to work with someone that my husband does love too. So, but yeah, we went to high school together. Both played basketball, so we crossed paths a few times. Went to Missouri State. Didn't really see each other there because we were different majors to begin with. Ended up first day of dental school orientation, he was there. Instantly I had a comfort in my heart having somebody there that I recognized and I knew. It helped tremendously to have someone from back home. Made it feel like I had a little bit of Springfield with me. So we talked a little bit here and there, and of course him being the leader he was our class president. So it was probably about third year though that we talked about how cool it would be to come back to Springfield, where we're both from, and practice together one day. I heard that he purchased Innovative Dental. This was about a year after graduation. He said that, he would love to one day practice together, but he wasn't quite ready. He needed a couple years probably. He said that exactly, about 2 years. Said, I don't care how long it takes. I'm gonna be patient. I know that was where I was supposed to be. So I hung tight. I wasn't in a huge hurry myself. So it was about 8 months. He gave me the phone call. Took a leap of faith. I was at a place that I had comfort. I knew, I knew my work hours. I knew my paycheck, and it was easy. I was pregnant at the time, so it was hard to just jump ship and find something new, but I literally had no hesitation. What do you think is kind of like some of the unique characteristics you've brought to Innovative Dental that make you excited to be a part of this team? Yeah. Well, I do think, being a woman, it's all women usually with a male dentist. We have several patients that do feel a different comfort with a woman. For sure. Also kids, I think a lot of kids are drawn to sometimes a motherly figure. He's very They look at me and go, goofy. I don't know about this guy. But he's very goofy. But I do think kids just naturally can cling to, a motherly figure as well. What is your one thing that kind of gives you excitement to work hard every day and come in and change lives? Yeah. So it honestly is not even the dentistry part of it. That's the bonus. It's getting to know people, gratitude for people. I've become so much more grateful in my life from being here. So yeah, that's not even tooth related. Sorry. Yeah, that's an awesome answer. I like that. I'm gonna have to steal that one. I like it a lot. Yeah. But what's an example of a person that sticks out in your mind? You're going, that I'll never forget them. That was so cool to be a part of
that journey for them and see the transformation?
Mary, our patient that we've actually done an interview with, one of my orthodontic patients, she came in with a story that's incredible. She could have given up on life a long time ago as far as having a rare medical condition and being told there was no cure for it. So we were literally her light in her day, in her week. She looked forward to coming to see us. She was so bright when she came in. To change someone personally is incredible.
I'll put the link above here. You can watch the interview, the full interview. It's Dr. Megan and I and the patient, and I think Des is even in that video. The real heartfelt openness from the patient about, you know, what even moving teeth into the right position, how it really impacted her whole life. So, you know, I know there's a lot of dentists or soon-to-be dentists or people in the dental field that watch our channel, and what a cool profession to be a part of, that we have opportunities to build relationships like you said, but then not just be so surface level at fillings and just a crown, but we're able to really make an impact that really transforms a life, gives them a different sense of confidence, joy. I had a gentleman the other day in a consultation say, you know, I've got a lot of joy inside and I don't feel like I can share it. And I know there's a lot of people that are maybe watching that maybe that's the way you feel. Dentistry can be a really big part of providing that key to being able to express yourself openly and really live the best you. So I love that. Cool.
Yeah. And we have so many patients that, you know, they say their biggest regrets that they wish they would have done it sooner.
Right.
Because it changed their life so much that they feel like they missed out on the past, you know, 10, 20, 30 years of smiling and being happy.
What's the favorite thing you've gotten a patient to say about you or our team or your work that you can kind of go, that really meant a lot to me to hear?
So when patients genuinely sense my love for dentistry, I love it, because that's truly, you know, who I am.
Sure. Oh, absolutely. I can definitely say that, second that for you. I've had the pleasure of working alongside you for 6 years, and very authentic in her care and excitement, fun attitude towards making people feel good and building that relationship.
Appreciate that.
All right,
Thank
you got
you.
some questions I'm going to steal from you. You had them hiding right there.
Yeah.
So.
As a kid, I never had braces. Honestly, no dentist ever told my mom I needed braces. Get into dental school and hello, all these big red flags. I needed ortho a long time ago. But when I was a kid, it's kind of not so, it's a little gross of a story, but my mom, my brother and sister all had retainers, and I was extremely jealous because I didn't have any. So I would steal their retainers and I would wear them, and obviously they didn't fit. They didn't fit.
Okay.
So I would steal their retainers and wear them, and then I would make my own braces with paper clips and bubble gum. So, I mean, that was back probably elementary school.
Okay.
Yeah.
All right.
So, my love for...
So you used to wear your sister's and your mom's retainers?
Yes.
Hey, that's okay.
I know, maybe I shouldn't tell that story.
I would have probably reserved that one and not tell.
Yes.
But now that you've said it, it's gonna.
Well, people
we're gonna
say,
have to get that out there.
we're so weird as dentists because we like to be in people's mouths, and I've never once thought that was weird. So that's probably weird.
Yeah. Hey, okay.
But honestly, the second we started dental school, I knew that I wanted to go into orthodontics. We're getting, you know, close to the 4th year. I'm like, I'm done with school, really. Because, you know, you put a lot of time and energy, and honestly, I didn't want to be filed into just one field. I wanted to do braces, but I didn't want to just do braces.
Sure.
So that's when I furthered my education and got, you know, continuing education, multiple hours, different.
Hundreds of hours.
Yes, yeah, hundreds of hours, and different areas too, not just all one. Yeah, I mean, I loved it from the get-go. I knew I wanted to do it, but I wanted to do everything with a smile and not just braces, because a straight smile, as we know, is not, you know, just, that's not the only part of a healthy smile. You have to have the whole vision in mind. So I like doing all of it. But
all right, so outside of dentistry, what's something that you're going, I absolutely love this?
Well, number one, family. Family and God, you know, are a lot of my life outside of here. But I have 2 young kids, 2 and 5, so they keep me extremely busy. Of course, my husband keeps me busy too. But other than that, my fitness is really important to me. I feel like starting my day good. I get up at 4:30. I know I'm crazy, but starting my day with a clear mind, doing something that makes me healthier and happier, and then having my evenings free with my kids and my family is just great.
What would you tell somebody who's going, okay, I'm interested in dentistry, where do I start? What do I need to know about this profession?
I think you should definitely start with getting out there, and you know, unfortunately dentistry is not the same everywhere, but if you can find a place locally that you can start shadowing, getting your foot in the door, start learning about dentistry, I think it's one of the best careers to be family oriented, being able to have a flexible work schedule, but doing what you love. If you love helping people, if you love changing lives, the technology's allowing, you know, dentistry to continue to change. So it's not the same as it used to be, and that's what's so fun. You know, like I said, I love growing and changing, so we just get to keep changing with it.
All right, so thanks so much for coming onto the channel and you know, sharing your heart for dentistry and answering some questions, and I look forward to doing some more of this. So, but yeah, I gave you a chance. It was last time in that video that we did with the lady with ortho, and it was brutal.
Are you gonna link that disaster?
That's well, it's already in there. You can go back and watch it. But I want to see what you can do here at the sign off for Innovative Dental.
Okay. Well, Dexter's gonna
help you. So,
well, keep smiling. It looks good on you.
Wow, that was tons of energy. Everybody just felt how much you wanted them to keep smiling.
Well, I don't want to take your thing.
Okay, it's not my thing. I guess it kind of is my thing.
It is.
We actually have
cups
and whatever.
T-shirt.
All right, y'all. Thanks for watching. Keep smiling. It looks great on you.